When we're training our patients to correctly contract the multifidi musculature, we got to be very careful on taking it step by step to make sure that the patient thoroughly understands the proper position and that no compensatory strategies are being used. So when we're instructing Alana here, what we want to start with is just a basic cat-camel exercise so they learn how to dissociate the pelvis from the thoracic and lumbar spine. So Alana, what I want you to do is just pelvic thrust, good, and then now arch your back. Good. So we call these cat and camels. This would be the cat arch. This would be the camel. This is more of the swelling here of the lower lumbar spine with the posterior pelvic tilt. One thing we want to be careful of here, and Alana, you can keep going here, we want to be careful that she's not swelling too much here in the thoracic region, because then we can really just overlook what we're trying to do here in the pelvic region. So she's actually doing pretty well, keeping the thoracic stable and just focusing on her pelvic movement. So we can just watch her there. So when she comes up into this swell phase, so we'll come back down, good, and come back up into your swell phase, good, right there, hold there. Draw your belly in toward your spine, maintain that posterior pelvic tilt that we just talked about, okay? So as we keep that stomach really tight, let's just work on your breathing, okay? So this is always the first stage. Make sure patients always understand how to work on their breathing, keep the pelvic tilt, keep the abdomen drawn in through the spine, and really start just isolating this posterior tilt and gently contracting the multifidi. All right, so that's the beginning part of the training for the multifidi musculature.